मैं आदरणीय डॉक्टर KSR प्रसाद जी को सादर आमंत्रित करता हूं, जिनका पूरा जीवन मेडिकल एस्ट्रोलॉजी में निकला। उन्होंने एक ग्रुप बनाया है मेडिकल एस्ट्रोलॉजी का और वो हेड करते हैं उस ग्रुप को। ही इज अवर लीडर इन एस्ट्रोलॉजी एंड आयुर्वेदा। वेलकम सर।
Thank you very much, sir. I very briefly speak for 5 minutes, probably. One thing I just want to say, when we are doing the medical astrology, many times it is being found that we are not coming out with the proper evidences and rationalities. The question is, either the Brahat Parashara Hora or Jataka Parijata, whatsoever may be the text of the astrology, the authenticity of these texts is a questionable for the present area. As and when the combinations are going to be seen, they are being observed for the lakhs of the people. And very fortunately or unfortunately, I was in the field of this medical astrology for the past 35 years and trying to do the justification with the evidence. Here, I just will say a few sentences to discuss over the Madhumeha. Astromedically, it's a very big time it takes, in fact, more than one and a half hour. Asya Sukham Swapna Sukham Dadini Gram Yodakan Ubrasah Payamsi. This is what the Nidana has been stated in Ayurveda. When we are going to say the Asya Sukham and related with that of the food, it is the second house always we have to observe. The Swapna Sukham is the fourth house where the Vihara is going to be get observed. Second and fourth house are going to be influence any sedentary lifestyle or lifestyle disorders, very basically. Secondly, when we are going to see the Medascha Mamsajja Sarijin Chakledam, when we are going to say, already we got the houses, second and fourth house, Meda is for the Guru and Mamsa for the Shani and also Sarira Kleda for the Buddha. The culprits of the planets are the Guru, Shani, and Buddha, a triad which is going to show a combination permutation in any chart is going to be giving very specifically the diabetes. Relation with the 6th house, 8th house, and 12th house, always we are going to see. 6th house, it is going to be get with this disease, and 8th house is going to be cause of the death, and 12th house is recovery from the disease. I did not see or heard any patient who is going to get rid of the diabetes. Fortunately, in my practice, a couple of patients, those who were followed my prescriptions, they get rid of the diabetes. This I can proudly announce even on the dais. Now the question is, when this 6th, 8th, and 12th lordships are going to be there with, a relation with the Sarira Anga Prachanga Vibhaga is the most important. What are the bodies? Many times people are claiming, even I question the Krishnamurti 249 sub-lord theory concept where the organs are being nomenclated. The reflection of the planetary constitutions are not being reflected with the organs. Thereby, I have derived a 108 part of the Anga Prachanga Vibhaga, and I have made the research for the past 35 years. Now I am very comfortably can draw a conclusion what sort of the planet it is. Because one thing which we have to observe here is we are having a dialect of the Anuvanshika or the hereditary origination, dietetic in origination, or sedentary life in origination. That means at least a 3-tier or 3-modal diabetes are available. We can very comfortably control these things. And biggest part is, even though there is a yoga established in the Kundali, people are not going to be with. I just see one person who is in this Guru and Shani in the 2nd house. The Guru is supposed to be a Madhura Dravya Ahara Viharas, he is going to be adopted. Shani is going to obliterate and he is going to give the discomfort to that of the food. Thereby, the Guru and Shani Yuti, when it is going to be there, then the balancing of the food is going to be there and he is not susceptible for the diabetes. Yoga is the most important, and we have to observe the Yoga Bhanga, how the rule is going to be get broken. When we are speaking of the Anuvamshika or hereditary diabetes, a relation with that of the fifth house lord to that of the Guru and Rahu in the fifth house, Putrakaraka along with is going to be there. If at all we are going to see these combinations in the parental horoscopes, mother and also even the father of the child, then we can certainly say the relationship is going to be get established. So I don't want to say much more things. One thing which we are missing here is the psychological involvement in the diabetes. Whenever we are going to the physical diabetes, we have to follow the Lagna Kundali. And whenever we are going to see a psychological stress factor, which is causing a diabetes, at that time we have to follow the Chandra Kundali. That means Chandra as a Lagna, Chandra Lagna Kundali has to be get followed. Of course, the remedial measures out of that, when we are going to say, Arogyam Bhaskaradichet, the sun is the one ultimate person. Sun in horoscope is going to be seen for the Atma or the soul. A person, whoever is going to have the strength of the Atma, Atma Nirbharata, then the person is going to conquer the diabetes. And of course, in Ayurveda, to control the diabetes, it is said to walk along with the goats and goat milk to be consumed. At the time, the milk, which is going to be Payamsi, which we Dadhini and other things, are not going to be here possible. We are not going to make the breaking of the entire system, but we want to give the comfort to that of the patient in the diabetes. The last word, the death cause is going to become not the diabetes. I never see a person who died with the asthma. The same way with the diabetes, nobody will die. Only the question is, the person is going to die because of the complications. The complications are related with that of the organs, and especially this is all going to happen according to the Dasha, Antardasha and Vidisha lots. When they are going to be 6th and 8th and 12th lots, especially out of the triad of the Guru, Shani, Buddha is going to be there at the time. Certainly the death due to the diabetes is going to happen in a patient. Anyway, to support my theory, I have not less than that of the 150 horoscopes which are linked with. Thank you very much here for the opportunity.
Thank you, sir. Thank you. We need opportunity from your side. I requested before 1 year to you that we should start a series when you was busy. So I started this series. So now I am requesting you, please spare your valuable time and bless this series on different disease wise. Particularly, we are concentrating focusing ourselves on lifestyle disorder first, and then serious disorder can be taken. Thank you. Thank you very much. Please do join, and I will discuss with you for next program.
Thank you very much, sir. Good day.
Thank you. Thank you.